What is narcolepsy? Narcolepsy is a chronic neurological disorder affecting the brain's ability to control sleep-wake cycles. It usually begins during adolescence, between the ages of 10 and 20 years old. The main symptom that all narcoleptic patients experience is persistent and excessive daytime sleepiness, no matter how much sleep one gets at night. People with narcolepsy usually feel refreshed after a night's sleep or even a brief nap, but will start to feel sleepy again in 1 or 2 hours. Narcolepsy is also characterized by the disordered regulation of REM sleep. REM stands for rapid eye movement and is one of the normal stages of your sleep cycle that involves vivid dreaming, saccadic eye movements, and paralysis of voluntary muscles. In people with narcolepsy, elements of REM sleep can occur at any time. This may result in further symptoms presenting, such as cataplexy, sleep paralysis, and hallucinations. Cataplexy is the sudden partial or complete paralysis of voluntary muscles while a person is awake and conscious. The episodes are usually triggered by sudden intense emotions, whether positive ones like laughter and excitement or negative ones like fear and anger. Sleep paralysis is similar to cataplexy, except the inability to move happens at the borders of sleep, either while falling asleep or when waking up. Hallucinations can accompany sleep paralysis as well and involve vivid imagery that can sometimes be frightening. Narcolepsy can be divided into 2 types. Type 1 narcolepsy is diagnosed based on the presence of both excessive daytime sleepiness and cataplexy. Type 2 narcoleptics, on the other hand, do not experience cataplexy. But what causes these different types of narcolepsy?
Narcolepsy may have several causes that are unknown at this time. What we do know is that cataplexy is usually triggered by intense emotions, but it is unclear why this is the case. Although not everyone experiences cataplexy, narcoleptics have one thing in common. It was found that most people with narcolepsy experience low levels of the neurotransmitter hypocretin, also known as orexin. Hypocretin is a neuropeptide hormone responsible for keeping you awake. So when people are experiencing low levels of hypocretin, they have difficulty staying awake. We don't know why people experience low level of hypocretin, but it is thought that people with narcolepsy carry a genetic vulnerability. But what is the prevalence of narcolepsy in our population?
Narcolepsy affects about 0.05% of the population, or about 1 in 2,000 to 3,000 individuals. We can further categorize narcolepsy patients by whether or not they have cataplexy on top of the other classic symptoms. Those having narcolepsy without cataplexy make up anywhere from 10 to 50% of those with narcolepsy. Narcolepsy is also comorbid with other sleep disorders, such as REM sleep behavior disorder. Factors like ethnicity may be related to prevalence. In European countries, the prevalence rate is about as high as previously mentioned, while it's been found to be as low as 0.0002% in Israel or 0.16% in Japan. Differences in study design, inclusion criteria, and, importantly, disease definition may play a role in variations in prevalence like this. Although the majority of cases are sporadic, meaning that the disorder occurs without any previous family history, there is indeed some genetic component. Those with a family history have an elevated risk and are 10 to 40 times more likely to have narcolepsy than the general population. Men also seem to be affected slightly more often than women. Now, what are some of the treatments for narcolepsy?
Presently, there is no specific cure for narcolepsy. Therefore, conventional therapies have generally been used to treat specific symptoms of the disorder rather than the underlying cause. The 2 most common symptoms of narcolepsy that are treated are excessive daytime sleepiness and cataplexy. To treat excessive daytime sleepiness, stimulants, such as methylphenidate, known as Ritalin, are primarily used. Meanwhile, to treat cataplexy, antidepressants such as SSRIs and SNRIs, as well as sodium oxybate, are more commonly used. However, these treatments often come with unwanted side effects, such as addiction, nausea, weight gain, and insomnia. Ultimately, the goal is to develop treatments more specific to narcolepsy. These treatments would be best suited to alleviate symptoms reduce side effects, and improve the quality of life of individuals with narcolepsy. Examples of such treatments that have been considered include orexin receptor agonists. These agonists would work specifically to compensate for the low levels of orexin found in the brains of individuals with narcolepsy.